talk about Healthy People as a roadmap. We look at it as a roadmap for nationwide health promotion and disease prevention that can help to guide us. We use Healthy People to look at where we are right now in our nation in terms of our health priorities, and then use it to think about that informed action that we need to take in order to move forward and make a difference. It provides those science-based national objectives over 10 years to improve the health of the nation. Healthy People is used to engage a network of multidisciplinary, multi-sectoral stakeholders at all levels. We use it to create a comprehensive strategic framework for health promotion and disease prevention issues. So it's not just individual objectives. It really is important to think of it in terms of that framework mindset. And it also includes, obviously, those specific measurable objectives that help us get to where we want to go in the future. We use Healthy People in a multitude of ways. So we like to think of, besides the roadmap, we think of Healthy People as a menu from which you can choose, select different a la carte items. So kind of a buffet line, if you will. You can be used as a data tool for measuring program performance, a framework for program planning and development, a goal-setting and agenda-building platform, being able to set benchmarks for local and state initiatives, foundation for teaching public health courses. We're working on a toolkit right now to work with academia to help teach public health courses, and a national agenda for forging partnerships, both traditional and innovative. And I'll talk a little bit more in a few minutes about the social determinants of health and how we're really trying to incorporate that framework into what we're doing, and that gets into more of the innovative partnerships that we're trying to promote. This just tells you a little bit about the evolution of Healthy People. I think it's important to understand that Healthy People, as Lauren said, has been around since the Carter administration. Not many things that stick around from administration to administration. As we all know, we work on these great initiatives, and then 4 years or 8 years later, we have to work on something else. So we're really proud of this. We think that it really speaks to the fact that Healthy People is relevant across time, across political parties, and across our nation in terms of moving us forward. So you can see here that the number, where is it, at towards the bottom, the number of measurable objectives has grown. It's increased pretty dramatically. So right now, Healthy People has approximately 1,200 objectives, or 1,200 measures, and when we were developing Healthy People 2020 a few years ago, we thought we wanted to decrease the size of Healthy People, moving from Healthy People 2010 to Healthy People 2020, and we received a lot of feedback. And I was actually not with ODPHP at the time, but I was part of Healthy People from the Adolescent Health Work Group and the Population Family Planning Work Groups. And Healthy People went around, ODPHP went around and talked to many people, focus groups all across the nation, both and at all levels of government and non-government. And people said, yes, absolutely, decrease the size. We want it to be something that's smaller than we can really use. But the caveat is make sure you include my topic area and my agenda. So we couldn't do that. So instead of decreasing the size, we made it more manageable. And that's really what we've tried to do with Healthy People 2020. And we've done that through a couple of different mechanisms. The first is the leading health indicators that Lauren spoke about a minute ago. And there's those 26 indicators across 12 topic areas. And those are that critical subset of indicators that we think you really need to be able to focus on to make a difference in your community in terms of the health of your community. So we've done that to make it more manageable. And then we've also tried to make it more manageable through healthypeople.gov. So I'm going to talk to you a little bit about healthypeople.gov and the tools and resources we have available on healthypeople.gov. I was going to do a live demonstration at the website, but I've done that before and then come in and had no internet connection and something went wrong, so I was not willing to risk that today. So I am going to just give you some quick screenshots, but I do encourage you to go and check out the website if you haven't already. Healthy People 2020 in general, because we knew when developing Healthy People 2020 we were going to move to this format with the website, and it's designed to be user-friendly and accessible to everyone. In past decades, you had to kind of go through, I don't know if people remember the binder, I mean the big books, yeah, and they're great for to hold things down for paperweights, but they're huge, and I have them in my office right now, and I have to go back and look at things from past Healthy People. It is very cumbersome, and we get that. So we've really moved away from that, all those spreadsheets, all those charts, all the paper. And right now, Healthy People 2020 allows you to go to our website, and you you can go straight to the information you want. And it's a much easier way to look at healthy people. So let's do an example. And if you were interested in learning more about the maternal, infant, and child health topic area, an objective in the topic area or just the topic area in general, you would want to go to this objectives tab, so the topic and objectives tab. And towards the bottom, I'm not really good with doing screenshots, so please excuse them. It just gives you a sample. So towards the bottom, you'll see that there would be a list of all of the different topic areas. There's 42 of them, and with 1,200 objectives, it can be challenging to find what you want. So we've tried to organize them in multiple ways. So you could go to topic, scroll down to maternal, infant, and child health, and then you could find all of the objectives related to maternal, infant, and child health. Or you could go to the objective search tab, which is the next one over. And that's a tab that if you're not sure, you want something, you want some information about something that you think might be related to moms or babies, or maybe it's really in access to health services because it's about insurance, but you're just not sure where it would be, you could actually go to the objective search tab and type in information, your search criteria, and then go and find the objective that way. So, but let's say you went to the maternal, infant, and child health topic area. That would put you here, where you've got lots of different information on this topic area, starting with the overview, and then we're going to go through quickly those tabs right there next to it, because we wanted to give people several options to be able to learn more about whatever area they're interested in. So one of the leading health indicators that we have is reducing preterm births. So I went ahead and highlighted this particular area. So when you go onto our objectives page, we didn't just want to list out the objectives and give you the text for it. We also wanted to make sure that we could give you a quick snapshot of the data that we have available. And so this is our data tab, or our data block, as we call it, and it just gives you the quick information on it. So you can expand each of these objectives to find out more information. It tells you about the baseline, tells you about the target setting method, and the data source. You can also go in and get more information on the data, which I'm sure many people here in this room would be very interested in. And that's you can do that through our Data 2020 tab. And I'm going to tell you about that in a minute. It's a really great new resource that we just launched in March, I believe. But before I go into that, we also have, we've heard from people that healthy people is fantastic. Everybody loves it. We get it. It's a little overwhelming sometimes, but once you get to know it, it can be your friend. But so what? So we've got these objectives. We want to move in a certain direction, but how do you do that? How do you get there? And so we have worked very hard to come up with different interventions and resources that will move you towards these objectives. So we have many people within and without the government and outside of the government that work on healthy people, that work in the different work groups related to each topic area, subject matter experts that just cull through information after information, programs and strategies, and have come up with lists of evidence-based resources that are available for, that are available and related to each of the topic areas. So this gives you a quick snapshot under this topic area. But we just recently launched our new interactive tool. And this is another tool that we launched just in March. So you guys, this is perfect timing because this is all new. And our evidence-based resources tool is a way that you can look up strategies, programs, initiatives that are evidence-based. So they're going to be of the highest caliber. Right now we're only showing what we have a rating system of stars, 4 down to 1, and we're only showing 4s and 3s. So those are systematic reviews or studies that looked at multiple, or programs that had multiple evaluation studies done on them. So they're very high quality, high caliber programs. The evidence-based resources tab allows you to go through and enter in multiple search criteria to try to figure out what are some, let's say you're interested in working with American Indian population. So let me just click that one, and I want something that is a systematic review and something that's going to reduce injury. So then I can click in on all of those characteristics or those criteria, and I can hopefully come up with a particular evidence-based resource that would be appropriate. And then you might have to play around a little to find one that's really going to fit your needs in your community, but at least you have something that meets the criteria of what you're looking for. This is another example of some of the things that we have available on the website. This is a national snapshot, so we're very big into infographics now. We're trying to get hip and, with the government, but we're trying to kind of branch out a little bit. So we have national snapshots and a national data tab for each of the topic areas. And the snapshot just gives a nice pictorial of what's happening related to different objectives. So this is our Data 2020 tab. You're going to notice that we're big onto these searchable databases now because we do think that makes the most sense. We don't want to dictate to you what it is you need to be looking for. We want you to be able to input the information that you want. So Data 2020, we're very big firm believers at Healthy People 2020 that data is key. It's absolutely critical. It's going to drive everything that we do. And Data 2020 is a way that it can bring data to life for us. And so we really try to promote the use of data in everything that you're doing related to healthy people. So this is our newest search instrument in addition to the evidence-based resources, and you can go in and pull up data related to each of these areas, to the different topic areas, to the data sources, and it allows you to do a bigger search. You can print tables, you can print charts, you can print graphs from this. So it makes it come to life for you a little bit. Here's an example of a chart that just shows how we've moved with respect to preterm live births. We've moved from our baseline of 12.5, or 12.7, excuse me, and we've got the red line is the Healthy People 2020 target. We're not quite there, but it's 2013, so we got time. And so we're moving in the right direction. So it's a way to show that data. This is a tab just to tell you a little bit about the fact that we have different learning opportunities at Healthy People. We have our new e-learning modules. We only have one e-learning module right now, but we're planning on doing more. And right now it's on obesity, a community initiative out of San Diego. You can get CEU credits for it. But we also have all of our webinars are archived on our website, so we would encourage you to go there. I can't ever do a presentation without putting a plug in for the Healthy People Consortium, and that's a group of about 3,000 organizations that are committed to promoting healthy people in some way, shape, or form. And so I encourage you to go on and get more involved with Healthy People, with the Healthy People Consortium.